Hey friends, welcome back to the channel. Number one, please subscribe. I want to keep sharing more fertility and health related information to more people. Thank you. Number two, the COVID vaccine and breastfeeding. So the COVID vaccine videos, I have two other ones. So I have a video that is right here, and it is busting the myth that the vaccine is going to cause female sterilization or infertility. There's actually no truth to that, so don't believe that one. Number two, I have a video right here which is going over ASRM guidelines for people who are trying to get pregnant, undergoing fertility treatments, or pregnant or lactating on what they should do. But I didn't really dive into the breastfeeding question. And so I thought it'd be good because I'm getting this a lot and there's some other good videos out there, but I just thought I could break it down very quick for you so that we could feel confident getting the vaccine while we are lactating if we want to. Okay, so quickly, when you breastfeed, why is breastfeeding even considered good for you? Breastfeeding is considered good for you because the body makes antibodies. When you make antibodies as a mom and you breastfeed your child, you're going to pass those antibodies through the breast milk and into your child. That's fabulous. So then your child is protected against future diseases that they may encounter, which is great as they're building up their immune system. You're also sending them other kind of fighter cells from the immune system like T cells and macrophages. This is helping your baby be prepared against any disease it may encounter. Now, that's why breastfeeding is recommended. That's why if you can breastfeed, it is best. Now, really, fed is best. So as a side note, breastfeeding is really hard. I had a hard time with it myself. It was really, really tough. So there's no judgment here if breastfeeding is something you want to do, but you're having a hard time doing. But I even did research back in medical school. So the only research project I did in med school, looking at ear infection rates in women who breastfed versus not. And that showed that at 6 months, there was a decreased incidence in ear infections in the children who were breastfed as compared to the ones who are not. And then there was no difference at 12 months. So if you could exclusively breastfeed for 6 months, you had some benefit. That's not the point of this, but that's the point of saying that's why so many people are encouraging breastfeeding anyway. Is yes, it's great for bonding and connecting with your child, but it's actually to help them grow their immunity. Coming back to the COVID vaccine. Vaccinations have not been associated with harm, and this is an mRNA vaccine. So as we've reviewed in other videos, this is just telling your body to make the spike protein so you can have antibodies against it. So there's no virus happening in your body. And if you're making antibodies, those antibodies can then be passed on to your child. And so even theoretically, there's no thought at all that the vaccine is going to cause any harm at all to your child. And studies have shown that actually there may, after the vaccine, be IgA production, which is one of the types of antibodies that lives in breast milk. So actually in your body, there's all these different types of antibodies. You may have heard of these when we talk about COVID, IgG, IgM, IgA. The point is when you're breastfeeding, the IgA antibody is what can pass through breast milk. And now your body has antibodies that if you're breastfeeding your child, you're passing on to them. That is really amazing. And this is going to have huge potential benefit because not only are you protecting yourself against getting COVID, you're protecting your possible child from being exposed and getting COVID. And we know, yes, COVID doesn't tend to be as bad in children, but it's not that it doesn't exist. And we can't really predict who it's going to be bad in and who it won't be bad in. Also, let's just think about what happens if you get COVID and you're breastfeeding. Are you going to breastfeed your baby? And if you're breastfeeding your baby, now you're not at risk of giving the baby the virus through the breast milk. We haven't seen that either. But now you're worried about getting the baby sick because you're in close proximity. So now you're potentially having to be separated from your child. So that doesn't make sense to me. This is why all of the organizations, so the CDC has said, you should feel comfortable getting the vaccine if you're lactating. Lactating and non-lactating individuals should both be getting the vaccine at their designated time based on their risk stratification. So has ACOG, the American College of OBGYN. ACOG has come out and said, you should get the vaccine if you're lactating, if you feel comfortable with it, because no theoretical risks in breastfeeding, but huge potential benefit with IgA production and protection of both you and your baby. Also, the American Academy of Breastfeeding Medicine said the exact same thing. I'm going to read it here for you because I liked their line. While there is little plausible risk for the child, there is a biologically plausible benefit. Antibodies and T cells stimulated by the vaccine may passively transfer into milk. Following vaccination against other viruses, IgA antibodies are detectable within milk in 5 to 7 days, and antibodies may be transferred to milk and therefore protect the infant against SARS-CoV-2. It does say one last line that I really like. Although the biology is reassuring, for definitive information, we will have to wait on trial-based data. So yes, in all of these vaccine videos, this data is changing. So this video is being released on Christmas Eve, December 24th, 2020, and we may have new data in 3 months from now. So this is only active as of currently because lactating women were excluded from the trials. So correct. We are making the best decision with the data we currently have available. If you're not eligible for the vaccine right now, you have frontline workers who are pregnant and lactating stepping up to the plate and getting it because they believe in the science and they want protection for themselves and their child. You will have more data from them when it is your decision. So you should be paying attention and interested in all of this, but this will be becoming more apparent as more time goes on. If you are pregnant or breastfeeding and get the vaccine, you should register for the CDC Be Safe information. This is going to be a monitoring system where you can say that you're pregnant or lactating, and they're going to track adverse reactions and long-term outcomes from the vaccine. So highly encourage that so you can help people get more data. There was a request for my own video of getting vaccinated. I got vaccinated this week. I had a sore arm for 2 days, like really sore, and I had some fatigue that was much more than normal, but I'm feeling much better now. So I felt very thankful. I was extremely emotional when I got the notification that I was able to get vaccinated. I think because there's just been so much anxiety as a healthcare worker, and I opened a fertility practice with my partner this year, and the responsibility and the domino effect that would happen if I got sick. To my patients, my partner, my family, our staff. I think I've just been carrying that anxiety with me this whole time. And so being able to go and see the light at the end of the tunnel was very emotional for me. So here's a little compilation video of myself getting the vaccine. And to all of you, remember, this is shared decision making. Always talk to your doctor. You can do what's best for you. There shouldn't be judgment. My goal is to provide education and information so you feel like you can confidently make the choice without all the misinformation out there. As always, you guys can follow me on Instagram at Natalie Crawford MD.